Let's talk about an old-timey remedy for heartbeat irregularities, for tachycardia, for too fast a heartbeat, for bradycardia, for too slow a heartbeat, for missing heartbeats, for irregular heartbeats, and for a weak heart that doesn't pump out enough blood. The American Indians used to use hawthorn for these things. They also used hawthorn, by the way, for gloom and depression. Now, the best hawthorn supplements out there are not the herbs in the capsules. Those are all fairly weak. The best hawthorn supplement that I have yet found is from Gaia, G-A-I-A, Gaia Herbs. You can go to GaiaHerbs.com. They're in Hendersonville, North Carolina. And the hawthorn paste, which is what they sell, the hawthorn berry solid paste, should be taken at 1/4 to 1/2 teaspoon 3 to 4 times a day with folks who have these heartbeat irregularities. The hawthorn will help to promote not only a stronger heartbeat, to increase the amount of blood that gets pushed with each pulsation of the heart, but also it will help to manage the heart rate so it doesn't go too fast, so it doesn't go too slow, so it doesn't skip beats. The hawthorn does all this very well and without the toxicity found in a good many of the medications used for the same purposes. Now, I do have to say that whenever you have a heartbeat irregularity, whether it's too fast or skipping beats, you also have a magnesium deficiency. Magnesium is the mineral that creates muscular relaxation. Calcium is the mineral ion that creates muscular contraction. When you get calcium into the magnesium channels, you have a contract signal instead of a contract-relax signal. So along with that 1/4 to 1/2 teaspoon of hawthorn 3 or 4 times a day, it would be a good idea for cardiac patients to take between 1,000 to 2,000 milligrams of magnesium citrate. The magnesium citrate is the best absorbed and fastest acting form of magnesium. It's also the least expensive. You can walk into the laxative department of your local drugstore and find the little bottle of magnesium citrate liquid. The clear stuff tastes like lemony 7-Up. The red stuff tastes like cherry soda. If you take 1 tablespoon in the morning and 1 tablespoon in the evening, that will yield 1,745 milligrams of the best absorbed and fastest acting magnesium. Now, for folks who have a tendency towards having loose bowels and with whom the magnesium will cause diarrhea, those folks can use magnesium glycinate, Glycinate. You can find these in health food stores, and the magnesium glycinate will be a help to you in helping in regulating heartbeat. For those folks who suffer from ischemia, from a lack of oxygen and ATP supply to the heart, 2,000 milligrams of arginine ethyl ester, that's arginine ethyl ester, helps to open up all the blood vessels in the body, but especially those going to the heart. And what we've found with patients who have ischemia pain, the pain of a lack of oxygen in the heart, is that the arginine ethyl ester really helps to open up circulation and take away the pain, improving the blood supply to the heart. The one final thing I would add with any heart patient is between 1,500 to 3,000 milligrams of a non-estrogenated vitamin E, a vitamin E without estrogen. Remember that all the vitamin E available these days is made from soy. And so even a small capsule of vitamin E has at least 1,000 milligrams of estrogen in it. Now, a few weeks ago I was ragging on CoQ10, and I will reiterate that vitamin E in doses above 1,500 milligrams, 1,500 IUs, has the exact same actions of preserving the heart against injury that CoQ10 does, and usually for a heck of a lot less money. It also has the action of improving your libido, your ability to make love, your ability to make sperm, your ability to feel passion. So there are so many benefits from vitamin E that all the junk science that is out now trying to disprove the usefulness of vitamin E, or even saying that it's dangerous or, heaven help us, carcinogenic, all that junk science is focused on getting you away from vitamin E so they can sell you a very expensive drug, and probably very deadly drug, to substitute for the vitamin E. Don't believe any of it. Vitamin E is extremely safe, one of the safest nutrients we have. The only toxic vitamins around are vitamin A, vitamin D, and niacin. You cannot OD on vitamin E. It will be good for your heart. It will make your heart beat stronger. It will improve the oxygen supply to your heart and the slickness of the blood going through your heart.